So in our discussion about Ondansetron with the trade name of Zofran, we will cover topics including its mechanism of action, therapeutic uses, pharmacokinetics, adverse effects, drug-to-drug interactions, and contraindications. So Ondansetron works by antagonizing the serotonin 5-HT3 receptors centrally in the brain and peripherally. So centrally it antagonizes the serotonin 5-HT3 receptors in the chemoreceptor trigger zone in the brainstem. And normally the neurotransmitters like serotonin and toxins and other signals play a role in mediating nausea and vomiting by activating the chemoreceptor trigger zone. So by antagonizing the serotonin 5-HT3 receptors by the ondansetron in the chemoreceptor trigger zone, ondansetron works to suppress nausea and vomiting. Now ondansetron also works peripherally by antagonizing the serotonin 5-HT3 receptors in the vagus nerve terminals. And normally, the vagus nerve can sense nausea and vomiting triggers in the gastrointestinal tract and delivering those sensations to the nucleus tractus solitaris in the brainstem, and this is another region important in vomiting. So by blocking the vagus nerve terminals by the ondansetron, nausea and vomiting are suppressed. Now most of ondansetron anti-emetic effect is coming from the peripheral serotonin 5-HT3 receptor antagonism with a minor contribution coming from the central antagonism. Now let's talk about the therapeutic uses. So the FDA approved therapeutic uses include the prevention of the chemotherapy-induced nausea and vomiting, and the ondansetron is the first line for this indication. And ondansetron also FDA approved for treatment of radiation-induced nausea and vomiting, and it is also the first line for this indication. And then it is also FDA approved for prevention of post-operative nausea and vomiting, and it is also the first line for this indication too. Now regarding the off-label uses, so ondansetron is used off-label for prevention of nausea and vomiting associated with pregnancy. So according to the American College of Obstetricians and Gynecologists, the pyridoxine alone or combined with the doxylamine is the preferred pharmacological therapy for nausea and vomiting in pregnancy, but in refractory cases, ondansetron 4 milligrams orally every 8 hours may be considered, and ondansetron in pregnancy is a category B medication. Now ondansetron also used off-label for acute treatment of cyclic vomiting syndrome, and it is used for treatment of severe refractory diarrhea associated with neuroendocrine tumors, which is the carcinoid syndrome. Ondansetron is also used in treatment of nausea and vomiting associated with gastroenteritis and in treatment of irritable bowel syndrome. Now let's talk about the pharmacokinetics. So ondansetron is available as oral, intramuscular, and intravenous formulations. The oral formula is rapidly absorbed from the gastrointestinal tract with 60% bioavailability, and ondansetron is metabolized by the cytochrome B450 enzymes in the liver and excreted through the kidney with a half-life around 4 hours. Now let's talk about the adverse effects. So the most common adverse effects with ondansetron include the headache, fatigue, dry mouth, malaise, diarrhea, and constipation. Less common adverse effects include drowsiness, sedation, local injection site reactions, and pruritus. And ondansetron may lead to hepatocellular pattern of elevation in liver enzymes and rarely may lead to acute liver injury. Now, most importantly, ondansetron may lead to electrocardiogram changes such as QT interval prolongation, and this may lead to arrhythmia called Torsades de Pointes, which might be fatal, and it also may lead to other types of arrhythmias, and the intravenous administration has a higher risk for causing these effects, and the FDA does not recommend a single dose higher than 16 milligrams intravenously to prevent those effects. And there is reported cases of bradycardia and asystole with this medication, and the ondansetron impairs the gut motility to some degree. That is why there is reported cases of intestinal obstruction, and this is a rare adverse effect, and this medication may lead to severe allergic reactions such as Stevens-Johnson syndrome in some patients. Now let's move on to talk about the drug-to-drug interactions. So concurrent administration with pymoside with ondansetron should be avoided because both of these medications lead to QT interval prolongation, and this would put the patient at a higher risk of developing Torsades de Pointes, and amiodarone and other torsadogenic drugs may also prolong the QT interval, and they may increase the risk for Torsades de Pointes. Now also, ondansetron may lead to serotonin syndrome if co-administered with other serotonergic medications such as the selective serotonin reuptake inhibitors. Regarding the contraindications, ondansetron is contraindicated in previous hypersensitivity reactions to the medication, and ondansetron is contraindicated in patients on apomorphine, and that is because this may lead to profound hypotension and loss of consciousness because of ondansetron enhancing the hypotensive effect of the apomorphine. Finally, let's talk about monitoring. So electrolytes and electrocardiogram monitoring are suggested in patients treated with this medication who have high risk for arrhythmias, such as a positive family history of a prolonged QT interval, or in patients with heart failure, or in patients with electrolyte disturbances. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe.